Washington may soon join Illinois, California, and other states in compensating the parents of developmentally disabled children under legislation considered by the Senate earlier this week. Tim Clouser with the Center Square is here with more. Tim, tell us about this bill and what it would do.
Yeah, so Senate Bill 5211, it was proposed by Senator Noel Frame. She's a Democrat out of Seattle. It's a bipartisan bill, has a lot of support on both sides of the aisle. It essentially aims to create a program, but to create that program, they're going to need permission from the federal government because it requires using Medicaid funds. This bill essentially asks the Centers for Medicare and Medicaid Services, which is a federal agency or office, to amend waivers that it offers. Now, one of these waivers is for extraordinary care. So, like if a person requires a level of care beyond what the average would be. But these waivers don't allow someone to be paid for that care if they're, say, the person's spouse or they're the parent of a minor child. That isn't included. So this bill essentially asks that office to amend its waivers to allow for parents to be compensated for the extraordinary care of their minor child if they're developmentally challenged. A lot of other states have this in place, like you mentioned, California, Illinois, and there are some differences between those programs, but what Washington is trying to do here certainly isn't unique, and they've tried to do this in the past, as recently as last year. Unfortunately, the bill didn't have enough gumption to make it through the legislature, but earlier this week, the Senate Human Services Committee had a public hearing over it. Over a dozen parents testified, many alongside their children, and the consensus among the legislators in the committee, in just the general sense of the hearing, was that it was a popular idea. I do expect it to move forward. We should know here soon whether or not that's going to happen, but I do expect it to go forward. Like I said before, the main reason that this aims to create a program is that they need the federal government's permission because it uses Medicaid funds. Now, most of the funding for this program would come from Washington state revenues, about 2/3. But that leaves about a third coming from the Medicaid services. So unless they're given permission from the federal government to do this, they're not able to move forward. And just to get a little bit of stats behind that, it looks like this program would cost about $10.6 million to stand up between now and the fiscal year 2027. But moving forward, each biennium afterwards, so 2027 to 2029, the program would cost $35.3 million, with about a third of that coming from the federal government. Same from 2029 to 2031. It's going to cost about that much.
And part of the reasoning behind this plan is a shortage of caregivers for families like this. Can you tell us a little about that?
Yeah, so Washington state already allows a child to essentially receive subsidized care if they need that extraordinary care. But that's through in-home caregivers. And there's just a shortage in the state. Washington state is having a shortage just in childcare in general. So that uniquely hits parents and families with developmentally challenged children. It's harder for daycares to accommodate these kids. So while we're struggling to get daycares, we're also struggling to get those in-home care providers. There's one parent who said she has a young daughter, and throughout her life, she's accumulated over 5,000 unused authorized care hours. That's hours that the state said that they would pay for this worker to do this work for this family, but because there's no workers there, the families aren't getting that subsidy. And essentially, parents are having to quit their own jobs that they go to financially provide for their family in order to just do that day-to-day care that the state's unable to provide due to that shortage.
You mentioned a number of parents did testify on this bill. What were some of the other things that other parents had to say?
Yeah, I mean, I spoke a little bit on it. There's just a lot of parents that had testified that had given up their jobs, some saying their dream jobs. One that stuck out particular to me was this woman who used to work for the city of Bellevue as an arborist. She said she was the Lorax of the street trees, but because of her child's condition, both her and her husband had to give up their full-time jobs to be able to provide that care that the state couldn't. And that was a theme across several people that testified that they can't continue to provide this care at home with no income. Some people had to move out of their homes and away from friends and family. Others are facing cases where they might have to send their child out of state to be institutionalized elsewhere. One parent brought that up and said they were basically told their only other option was to institutionalize their kids somewhere else, likely in Kansas, which already has a program like this that pays back parents for providing this care, ironically. So that was some of the sentiment that was heard among parents, and is very similar to the hearing last year, and was heartfelt by the entire committee.
Well, Tim, thank you for your insights on this story. Listeners can keep up with this story and more at thecentersquare.com.